My name is Dr. Anirudhha Hazra. I'm an assistant professor of medicine at the University of Chicago in Chicago, Illinois, United States. So in thinking about the transgender population on a global perspective, I think we didn't have a lot of data on the health outcomes and health data of this population until relatively recently. And that's because no one really cared to actually take a look at this population until just about a few years or so back. What we do know is there's certain communicable illnesses that disproportionately affect transgender men, women, and other gender diverse individuals across the world, not just in certain countries, but really globally, that are a concern for really global equity when it comes to healthcare and health outcomes. Specifically speaking, transgender women compose of 19% of new HIV infections globally, compared to less than 1% of the general population. We see these, again, communicable diseases fall along racial and socioeconomic fault lines, and transgender individuals are no different. There are several challenges and obstacles when it comes to taking care or finding care and access for healthcare for transgender people. I think the biggest issues really come from a structural level of marginalization of a population that has really not been served by the greater population. And the bigger challenges, structural challenges, really come across in ways of how people are not able to access the care that they need, whether due to inability to access funds or the privilege to do so. But then if they even have the privilege and funds to access care, finding care that is oftentimes violent against them, disproportionately does not benefit them, and does not provide any affirmation to their identity. There's multiple layers when we think about barriers of accessing healthcare for transgender people. I think you can look at it again from an individual to a systemic level itself. On an individual basis, transgender populations often don't have the resources to even access healthcare, health insurance, or even find a primary care doctor. But on a structural level, we see issues of that just not having any doctors who are able to take care of transgender populations. Doctors who don't feel well equipped, don't have the education to actually understand the needs, the healthcare needs of this special population itself. All the more reason why medical education has to become more competent and inclusive of these populations in order to really address the inequities experienced by transgender people in India. I think the world of medical education is really quite dynamic right now. I think the year 2022, countries around the world are reevaluating how we're teaching our physicians and future physicians of what healthcare actually means. Understanding, taking a less of a paternalistic approach, understanding the importance of shared decision-making. These are important aspects of medical education in the care of all populations, not just transgender populations. No country is perfect, and when it comes to this regard at all. Certain countries have had more work and have the ability to do more research around this type of work, more so. The United States being one, but even in the United States, there's huge amounts of inequity across different parts of that country that are able to provide access to this care. But yes, this is a very exciting time when we think about medical education globally, that we can really enact some changes which can really then be impactful in the care of transgender and gender diverse persons. So these draft competencies, I think, are phenomenal. I think this is a culmination of over a year of work among multiple disciplines across the country of India. I think these offers us a blueprint of how we can actually start to enact these types of changes in the medical curriculum. Through the work that Transcare India has done, MedEd has done, is really develop connections between higher level institutions like the National Medical Commission to really figure out how we can advocate for these competencies to be now implemented into the medical curriculum, which would be in line with the 2019 Transgender Persons Act in India. I think sensitization of future medical professionals is hugely important. Again, not just in the care of transgender individuals, but really in the care of all marginalized people. I think we more and more now understand the importance of medical providers to not only provide good medical care, but really provide empathy, empathetic care that can really help really build the physician-patient relationship. And so the work that's being done here by Transcare India is doing just that for a specific population that really needs it the most here in India. Collaboration is so important. I think what really makes this team so unique is the multinational collaboration here between the University of Chicago, the Chicago Center in Delhi, Sangat, as well as our community partners on the ground. I think we're able to learn from each other and able to see different forms and different models of healthcare that have worked and not have worked when we think about medical education specifically. And I think this type of shared learning is so important and really has been very enriching to me personally over the past 12 months. And I really hope we're able to continue this with the subsequent funding for future projects through Transcare.